Hello, my name is Deb Dewar and I'm the principal at St. Joseph Catholic School. Today I'm here to talk to you about the health screening process, since that's a very new process for everyone. I want you to know what you can expect, what we're looking for, and what symptoms you should be aware of. There's going to be a health station set up at the front door each day, except the first day. We're doing the first day at the walk-in gate that separates the parking lot from the playground, so that parents and students can be together in that playground area to help everybody get situated with the right teachers and on that first day. Other than that, it will be right in front of the front door at the beginning of each cohort. The screening is a quick check, and it will do two things. It will take your child's temperature, and it will ask you or your child 3 questions. Those questions are: has anyone in your family tested positive for COVID? Has the child been exposed to anyone outside of the family who has tested positive for COVID? And does your child have any of these symptoms? And those symptoms are fever, cough, chills, shortness of breath, and difficulty breathing. As long as the answer is no to all of those, this should be a very quick process, which is why I'm confident that we can get students through this very quickly, with the possible exception of the first day, as people get used to the idea and explain it to their children. But after that, it should go pretty quickly. If any of the answers to these questions are yes, then we need to go into a little more detail, and I need you to understand what those details are. For the first question, if there's someone in your household who has tested positive for COVID-19, then the OHA requires that the family stays home from school for 14 days from the onset of symptoms. The 14 days allow for the onset of symptoms for everyone to be able to understand who else in the family is going to get that. So it's really important that even if no one feels ill, everyone in the family stays home. And that's something that we will also track to help you keep track of the days. Please let us know as soon as someone in your family contracts COVID, because it is also our responsibility to not only track the days for your family, but to let the families of all of the children in your children's cohort know to be watching for symptoms. Because we're opening under the 2-hour rule, OHA requires that if anyone, any student or staff member gets COVID, then the entire school goes to completely online distance learning for 14 days. And that gives families the opportunity to check for symptoms and make sure everyone is safe before we reconvene. We know that it's important for children to be together, and we know that it's important for children to learn directly from their teachers in person. But everybody knows that the most important part is to keep all of our families safe and healthy. And we'll do anything we need to make sure that we're taking every precaution. So again, we're asking all of our families to be really thoughtful when you answer the 3 questions. The second question is about your child coming into contact with people outside of the home that have tested positive for COVID. Unfortunately, this is something that you find out after the fact. You've gone to dinner at a friend's house, or you've gone shopping with cousins, aunts, uncles, and whatnot, and then 3 or 4 days later, you find out that someone has tested positive, and they're trying to do all of the back contact tracing. We also are very conscious of the contact tracing that needs to happen. So as soon as you find out, please let us know so that we can contact the families of the members of the cohort of your children. Exposure is defined as someone that you've spent 15 minutes or more with within 6 feet. If your child has been exposed, even if they're not exhibiting symptoms, please keep them home for 14 days from the exposure date so that we can limit the possibility of anything spreading. Please let us know about it so that we can also put the students in your children's cohort on alert for watching symptoms. And the third question mentions the symptoms. Again, those are fever, cough, chills, shortness of breath, or difficulty breathing. We're dedicated to the safety of our children and all of our families. And we want to make sure that everyone who enters the building is as diligent as we are. So please take the questions very seriously and thoughtfully. One of the problems about the symptoms is that we're also coming on a season that often has allergies. Allergies have the runny nose and the cough that often goes with it. So that can be problematic in these crazy times that we're having right now. So here's what I need you to understand about this. If you have a child who has seasonal allergies and goes through a long period of having those symptoms, please understand that that's going to raise a lot of red flags for us for two reasons. One is that we're going to see the initial symptoms and be worried, and so is everyone else around your child who's going to see those initial symptoms. The second part is that if the cough continues, there's no way to know if that cough is continuing because it's allergies or because there are additional factors. So what we're asking is, if your child has a recurring cough, we need you to be able to get that cough under control, and we'll need a doctor's note stating that the cough is due to something that's non-contagious. Usually it's something we understand, but this year it's more drastic measures. The health screening will happen just as the students are being dropped off for their class to start. We ask that the parents stick around just long enough for the students to make it through the health screening. If there are any issues, if the students tell us things that might make it questionable as to whether the student should be in the classroom or not, we'd like to be able to go back to the parents and make sure that there's another way that we can get questions answered with some more detail. So please don't drop your kid and drive away before we make sure that the students made it all the way through the health screening, and it shouldn't take that long. We will be limiting the number of adults in the building to make sure that we're minimizing the risk to the students. So we're asking parents to drop their children off at the health screening and allow them to walk into their classrooms. The younger students, teachers, kindergarten and pre-K, those teachers will be out on the playground to pick the students up. Kindergarten eventually will go back in, but pre-K will pick up and drop off their students in the playground every day so that there can be signing in and out. When the parents are out of the car to pick up or drop off students, those parents or any other family members need to wear a face covering for the protection of everyone. In this coming week, we're going to make videos on how to wash your hands, on how to line up 6 feet apart, on how to wear a mask and handle a mask and not handle a mask. All the little details that it's really important for children to understand in this environment. We ask that you watch these videos with your children and answer any questions that they have so that when they get to school, they'll already know the basics. We will teach them again. We will help them learn. We will continuously reinforce this. We'd like to do it with a smile on our face because we know that kids learn better when they're happy. But these are really serious circumstances, and as much as we're going to tell them how important it is, we'd also like you to reinforce at home how important it is to follow these rules at school so that we don't have any issues for any of our students. We're trying to do something together that's good for all of the students. And it's difficult to bring all of these pieces together, and different circumstances in different families means there are different rules for a lot of people, and being able to bring all of those together is a very complex, complicated task. We really appreciate the help and the support that you bring with you, and I personally thank you. Really thank you for all of the support that I've heard from you for so many weeks now. Thank you very much. We'd like to continue to build an atmosphere where our children can have their academic needs met, their social needs met, and still have all of their health needs met. And that can only happen if we're working together. So thank you very much. Please let me know if you have any questions, or if there are other aspects of school that you have questions about that I can better explain to you. And I will see you in September. Thank you so much.